Mm-hmm. Mm-hmm. As I yesterday said, the quotation system is not we have in software. You, so it is not available, ma'am, currently in the software. This kind of the function for quotation providing for softwares, ma'am. Okay, so but if you need such kind of option, we can give an facility for master like that. So where you can define as some predefined format. For example, let me show something for you. If we go file section window, here you can define for like the uh, delivery quotation. Okay, and you can make here tabular format with the respective item services and rating like that, and just you can maintain, but it is not connected with the any Terry plan and automation, right? It is can be work like Excel format for a patient where you can generate the quotation like that. Okay, do I make a sample for you? Okay, fine. So let me proceed with the some work we yesterday discussed, and I will show with them update for you. So it is your work list for me. Okay, so the thing I will show one by one to you. Okay, forest park HMS. Sorry. Okay, I will make some little bit flow. It is your application. Okay, now I will show the point by point of the solution. Your the previous pending point, out of that one point was that when we are making a vitals entry of patient, it's color to be done, so we can identify for which patient we have vital we have updated and which are not updated like that, correct? It was a concern from you. So I open your application and we go to the token display window. Okay, do you see this screen? Yes, here you have this doctor patient is 7 quantity. If I click on that, so you can see these are the patient color coded. Here are two patient red where we have not collected any vital. Okay, if I take a patient's token, which token number is 5, if I want to click vitals, add vital. Okay, if I mention any vitals record from here and update like patient is dengue and I save data, so then the color will be changed. That means it will identify the patient's vital have been completed. Okay, so same way you can update the task. Let me try one more patient for go here, and here all these patients are there. If I try any one of patient, for example I say, let's say second patient, add vital. I mention the patient's vital like 110 by 70, 86 by minute, and respiratory by minute like that, and patient weight or something like that. I mention this entry and I have submitted with patient temperature like that and submit the record, and you can see the color have been changed, so you can easily differentiate patient whose vital have collected and who are pending. Okay, I'm sorry. You can check it, ma'am. Now it was this task have completed 1 hour before, ma'am, from backend side. So If you try now, you can check from your side also, the color will be changed once you add vitals and submit in the software. Okay, yeah, yeah. Now the next event we can discuss. Let me go the second event. So it is done and I have shown. Okay, shown also. The next point, a quotation that I show, that is not a provision in software package, so it is not available. After that was a prescription medicine stock. I have already shown in yesterday presentation the patient stock medicine, how can doctor check in the prescription writing window, right? Okay, so let me go to the software. Here we have the patient e-prescription module. We can select any one of patient for which like to see prescript, and there is, this is the medical window where we can write the medicine. Like if I select the product names here, and if system having respective medicine stock, like let's say I have some stock quantity about the product A, so here you can see the respective product quantity. One second, B product. Kuldeep, can you check once that I have yesterday changed this thing? Yeah, so this item is coming here, stock availability of respective product in some item which are available. Okay, so like this way. Okay, यहाँ ये करना है कि जहाँ स्टॉक नहीं तो वहाँ डिफ़ॉल्ट जीरो आ जाए, अगर कुछ वैल्यू नहीं है तो स्टॉक जीरो आ जाए करके देखो ना। हाँ, जैसे मैं ये कर रहा हूँ इसमें, तो ओके, यहाँ इसमें नहीं दे रहा, इसमें जीरो है तो नहीं देता रेस्पेक्टिव। ओके, so like this way you can able to find out respective medicine product quantity of the prescription event of the respective product here. Okay, so this is your medicine pre information of stock availability can be seen by doctor, and it can be shown in the presentation. I am already recording the video session. I will share the meeting video meeting link after the completion. Okay, and after having all department wise consultation fees defined master, I have uploaded in the master for all doctors which department have been allocated from your side. Okay, if you like to see, let me go in the master section. In the master window, here we go to view part and we check the consultation fee section. Here you can see cash price, local price, corporate price, international price for respective doctor wise and department wise, which we have defined given from your side. Okay, yes sir, it is. You can change, you can edit as from admin ID. You can change the respective value from local, insurance, corporate, and if you like to add for any new doctor, just click on add doctor fee. You can define here respective department wise doctor consultation for which department you like to add, and here put items name, cash amount, local insurance company amount, corporate insurance amount, and international amount for the respective company. Yes, okay, and if we go for next point, that is given from you, that is consultation with department at registration page defined in master. So if you like to check, for example, I go to registration and I will show, for example, go to registration. This is also have been fixed. If we select like corporate patient, and if I select any insurance company, and if I select like any specific doctor like urology for example, and if I select the doctors, after the consultation fees of the corporate insurance company price is picked by software here. Okay, if you change international, let me check one more international for same patient. If I select international tab and I select the respective company, if I select urology department, and once we select doctor, the amount is coming 1700 instead of the 8500. Okay, this has been also done. uh, After the 6-point vitals entry window, disease to be renamed with the diagnosis. So let me show, I think yesterday also already shown, but let me re-verify to you. Go to token screen window. If we go to any patient's data to update a vitals window, for example let's say this one, and there was a previous, the field name was the disease, so we have changed it with the diagnosis. Okay. Nurse, this entry will be updated by nurse for the patient. The diagnosis meaning what is the complaint of patient, why it was come. So nurse, we can write like fever, dengue or pain in chest, like that he can prescribe something. Okay, like fever, and like they will mention this record. Okay. Yeah, so this is have been also done. And after print a discount in total bill not in itemized, so that I have been also done the discount window in the receipt. I make a demo receipt and will show you. Let's go to the OPD or OPD billing window. I select the patient here. Okay, and we do the patient's item service. For example, laboratory test, we can perform here one item for this one. If I select LFT test, along with we go to the X-ray, so, and as well as the any USG item. Okay, so here we have patient 1890 total amount of patient bill value, correct? So we are putting discount in total bill value, not for itemized. Okay, so if I put here 90 rupees total bill value, or for example I put here 10% discount, and there is the bill value here. If I have patient collected part payment like cash, we have collected 1000 rupees. Out of mobile payment he paid like 500, like that, and some part payment due pending. Like this we do multi-billing also, and just if I save and print, you will have a very clear receipt for the patient, like this. So here your patient's total bill amount after the total bill value discount of the 10%, here after discount amount, and how much it was paid by cash, how much it was by paid by UPI, and how much it is due. And it's a total 1500 received, like the green colors total bill value, and 200 is due, so 201 is due, like this way. It will give you the receipt. We have updated the receipt format entries with the discount in the that was not in the software previously for you, so I have updated, like. Okay. No, it is will be authorized for the administrative permission given to the user only. Non-admin user will not able to make the discount. Okay. To if you want to do so, let me make an exam. Yeah. Yes. Okay. So for do, yes, to do so we need to go into admin login. Here you will have to use your administrative ID password. Okay, which is currently I think this is 1FPA, and you can change it later with the when you are needed. So we go to administrative login here, and you can select any one user. For example, I want to change the user ID Yogesh, do not authorized to make any discount. I click on the open, edit his permission, and here I will revoke the admin and super admin permission from module window from here. Okay, after this user will be disabled to making a giving discount, as well as if you like to specify some categories billing and everything, you can select specific services only. If you don't want to give delete permission, you can remove, edit permission you can remove. So the system will not allow such activity to this specific user. So I have revoked this permission, Now if I will check to the respective login ID like Yogesh, so let me check it. Why? And I click on user login. If I go any patient bill window, okay, if I am here and if I make any patient billing say laboratory test, for example CBC, I think you in your system it is still enabled. Kuldeep, can you come here for 2 minutes? It is to be disabled from your side. Our side it will have to activate the code. Here in the forest park, our master product is working, but if it is user is not non-admin, still it is the disable need to enable disable the discount window could not be available for anywhere. Okay, so I put here in my our notes to be checked. Okay, from master control if admin
डायनेमिकली करवा दिया है सर फॉर ऑप्शन से
admin or super admin not granted, then discount edit delete not come in respectively users. Okay, I will check it in some time and will update. I think they have to enable some service in branch account like that, super admin permissions.
सर यूज़र परमिशन बेस बनवाया है अभी
Yes.
ज्ञान सागर में नया इवेंट ये डिस्काउंट का कि यूज़र को अगर डिस्काउंट की परमिशन दे रखी है तो इनेबल होंगे अदरवाइज डिसेबल रहेंगे ऐसे जहाँ से यूज़र बनाते हैं ना ऐड और एडिट में
Sorry. Hmm. 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 Yes. Actually, we have disabled the services from some time when we. Mm-hmm. Let me check it that if you like to do. Yes, let me there verify that also. If I use here item or services, for example CBC, one second, CBC, what is coming here, for X-ray, if I use X-ray, and the price editing is not available here in the respective item services as it is the user is not authorized to do so. So this is disabled here. The discount window is need to be disabled. It will be done in some moment. My team said he will do from the administrative control. Okay. Yeah, the amount cannot be changed during the billing. Only the discount is enabled, that will be also revoked. And once if we do any billing, the edit delete permission is you cannot see after saving the record. Let me save. If I save this record and after that I want to make any amendment, so you have not any edit or delete permission to this user ID. Now you can see this is only print window is available. Okay, like this way. If you have admin access, then you can make them edit or delete of the entry of previous record saved by user. Okay, and after when we yesterday have a session, we have pointed some point. So here nursing desk inventory and ward consumable items bill to be done in the respective patient in credit payment, correct? So now the consumable entries to be billed into the IPD bill charges by nurse, so she can select any patient to do bill, and here they need to select ward consumable category. Okay, so we have put your ward consumable inventory in this category, so that will not as a product wise, it is a service wise as yesterday we have discussed. So there are your items. If I select this like burette 150 ml and the patients which tariff to be applied, the patient is IPD or international patient. So if I select this item, what is the item name, one second, burette 150 BUR burette 150 ml. Okay, if I select, so for international 170 price is coming. Let me check your tariff. So it's a 170 for international, correct, coming. If I check any item for ambulance also, let me check ambulance charges. Yesterday that was not coming. So if I select ambulance for this patient, and we select here ambulance category to select the ambulance item, and here the ambulance items are available. This if we select this one, and here 4306 amount coming with respectively international patient. So if you check here ambulance for this item, 4306 amount is coming. Okay, so this is your patient item service. We can do the respectively billing for patient. Now the bed charges, let me show what is the next point before we go next. Bed charges, so ward consumable I have defined in the ward consumable categories, and the patient ward consumable rate have been enabled with the category wise. Okay, cash, local, and you can check it under the billing cycle when you are like to test them. Local and corporates and international are done. Okay, sorry, international. Okay, sorry. And consultation tariff have been also updated. Ambulance charges has been also updated. Room charges, let me show how the room charges are coming. Okay, so that you are sharing me 4 kind of categories tariff apart from all. So it is sent by you that for semi private, deluxe, VIP, VVIP and ICU, correct, 5 categories. Hello, yes. So if I make a patient under any one of category out of that, so let me show the price before master. We go to master. Good. Okay, so we go to settings window, and if we click on view wards, the price is here of the bed charges for cash, local, corporate and international. Okay, now if I make a ICU patient admission layer to validate the international or local like that, I go to admission window, and will make a patient for demo. IPD admission, if we select international like that, and we select the respective company, and we can make patient admission like ICU demo Yogesh. Okay, for example, I put patient names, patient's doctor like urology. Okay, if I select the doctor's name and put mobile number of patient. Okay, and here patient address for admission purpose, and here patient's ward like ICU, and here we can select the vacant bed here. Okay, now at the time of admission we do want to bill any note item into credit. So if we are making any like patient registration into credit payment or something, or we can revoke that thing without payment consultation. We can save the consultation service also as a credit payment for the patient. Okay, the urology consultation services, and it should be credit payment, and just we save this record for patient. And if we go for billing cycle IPD site, and which patient we have created, 1 second, oh sorry, it is IPD admission. Yeah, this is your patient, which is why not showing this patient to my account. Yogesh. Yeah, this is here our patient. Okay, and you can see the bed charges of the international companies, ICU charges, which is respectively with your account. Let me show. ICU charges is where this is here. Okay, so it is 4410 for international patient category. Okay, so here your 4480 price have been coming here. Okay, sorry, I didn't understand. Repeat again, please. Urology patient, right? IPD validation. Let me check why it is coming. 1 second. We go to master. If somebody is not changed like that, if I check consultation fee, urology. 1 second. Who is the doctor's name? Doctor's name is Yusuf. 850, 800. Why it is coming for 800? 1 second. Yes. Kuldeep, check it. One thing. Is Prem is there? Hmm. Hmm. What happened? This is a IPD patient. I have registered into the IPD. While making admission, the consultation fees is taking its a cash patient price for IPD condition. It should be take for the corporate price for IPD also, not for only OPD. Okay. So this is the things is to be checked when you go to registration. Okay, and we go to here IPD admission window, and when we select the price for like example international or something company, and if I select the department like urology, and I select the doctor's name. Okay, sorry, hospital name. Why not coming? Medicine, general medicine or urology and urology. Okay. Let it recheck, refresh the page. If I go to corporate and I select company, and then I select urology. Okay, this is coming 850. Okay, if I select here international, and international should become urology. It's just coming. Okay, some okay it is, but it is OPD. Let me check. If I try page refresh. Okay, this is our application. If I go to log out and I log in with the admin ID or Yogesh ID. Okay, is there any administrative permission to be added to user for corporate services or not? If I go IPD now and select international, and here like company urology, and here we select a patient. It is not taking services. Okay, you seen? Oh, sorry, sir. There is some mistake with the entry, because we patient we done a directly admission. So that time it is to taking system consultation services OPD to IPD conversion. Now it's not fetching here. If I make one more entry to make it sure, uh, let me do a admission again, and I take demo patient Lokesh. Okay, and under international and patient type is we select here corporate or international. Okay, the company we can select here, patient's mobile number and patient address like, and I select IPD ward or bed number where we are admitting the patient. For example, if I select semi private ward, and here the bed number respective we can assign, and here, yes, sorry, if I select a doctor's consultation, sorry, urology. Okay, if I select urology, and the doctor consultation to be come here, not coming. Okay, if I select here consultation services, okay, consultation urology, you can check it. Okay, so this time also income to price of the IPD also validate with the corporate respective company wise, not for OPD only.
आईपीडी में भी कंसल्टेशन फीस लेगा।
Yes, IPD consult. Okay.
तो उसी को इनेबल कर देते हैं क्योंकि आईपीडी में कंसल्टेशन को ये
Yes. I have shown to my developer that was it validated only for OPD because he was assuming the consultation will be taken under OPD, not IPD. So we did not check for IPD services. I just observed that thing, sir.
सर्विस कंसल्टेशन ना दे।
Yes, sir.
तो ये तो सर तो रीचेंज करने पे कर देना कैटेगरी, उसमें जो जेसन में लोड करा के ला रहे हो।
Yes, I have noted, sir. Consultation in IPD,
एक तो डॉक्टर
in
सेलेक्ट करते हैं,
IPD
फिर वही लेके
also
आएगा, चार्ज डिटेल
same
आईपीडी
same as
एक वो
of OPD
तब भी वही उठा के लाए।
for cash and other cash, local, corporate and international.
ऑन चेंज पे जो कैटेगरी चेंज होती है रिपोर्ट वाली फंक्शन से लेके आता है।
वो आईपीडी को उससे कोई दिक्कत नहीं।
Yes, discount facility, discount
यार ओपीडी
in
अलग
non
फीस तो वैलिडेशन लगाना पड़ेगा।
on admin user
अलग अलग नहीं बनाया उसमें ये
disabled. Okay, ये डिस्काउंट का भी इसमें डिसेबल करना है सभी यूज़र आईडी में.
वो तो सर डायनेमिकली बनाया है, उसमें क्या
हाँ,
सारा
user.
डल जाएगा वो तो।
Okay, sir. So this is the one two small task we have captured in during this session, and the tariff we have uploaded in master with all the things. If you like to check them, you can go to the master site. That will become accurately validating, sir. We go to master here. If I select the panel or service category items here, number 14, here all the categories charges with the administration consultation services and ward charges and other things of all things we have uploaded in software, and you can go to pagination wise, you can check them one to one page wise. Surgeon fee charges and these are your charges fees list which was received from your site, sir. So we have uploaded operation charges also under the dental service charges, so like that. Okay, yes, so you can use them for the billing purpose. Okay, as you also see, I am not a admin person, so in the master I cannot change this pricing also. Okay, I am just can view the rate list of the respective product or services. But if I log in with this item services with the admin ID, for example FPH, sorry. Okay, if I try FPH 1 2 3 4 5 and we log in here, now I have in this ID admin access, so we go master and we can able to change tariff for item or service as this user ID is administrative access granted. Okay, so it's loading with the editable price list for all kind of service for different services. So you can see this input box have been coming here. Okay, with all kind of rate structure with the item name and like that. Yeah, so this was the our query session, and I will fix that 2 point that we recently discussed, and after might be in 30 minutes you will be also get it done, fix both point for the discount disable for user, and the IPD consultation shall be the same as the OPD for all insurance corporate local like that. Okay, yes, apart from that anything else you like to discuss? Okay, 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 tell me. patient lab report result. For laboratory patient, right? So the respective user have to go in laboratory account. Here if I go to laboratory module, okay, we have the list of patient for which the billing requests have been come, and the lab user can select the respective patient here, and they can prepare the lab report. For example, we need to prepare CBC and LFT reports. We can collect the sample for the respective test sample, data is coming, and we submit barcode sticker at the report sample collection event. Okay, now the next step, she need to upload the report. She click on the lab result window. Okay, this button, do you see? If I click on lab result window, this kind of the report page will appear to result window, and here this is the heading, where under this they can mention the result of respective test. Like for RBC test, this is the reference range unit, and this is normal value, and it is the patient result value window. Okay, for example 4.5 of this test, the second test is 70, 84, 700, like that. Here 12.5. So they can use tab button and go to next window and mention the result of respective test here. Okay, yes, like this way. And we can mention all report of the software. I fill and will show you 0.25 and 10 and 10, and so let me reopen the session. Hello. 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 Okay, so we was mentioning result here. Let me resume. So here we were uploading report of patient respectively. Okay, and I click the report value and I submit here. So the report will become in the printable section, and this kind of the report print you can give to the system, to the patient. Okay, yes, so they can mention the result like this way in the software. Okay, apart from this, anything other you like to discuss? Yes, all patient will become request in the laboratory module only. Either it is OP patient or IP patient. The laboratory department will be work in this window and select the any patient. For example, there you can see this is your IPD patient. You can see the status of patient OP or IP like that. Okay, and you, sorry. And if I select IPD patient also, I can have the same way the report preparation, selecting patient, get the lab result to be mentioned here, the respective result you like to update in, and just save the report from save test window here. 1 second. This is save test button, okay, where you can click the results and patient's report will be saved here. Got it, ma'am? Yeah, welcome, ma'am. Anything else, ma'am? Okay, tell me. Okay, so you mean to say if any patient who was already registered in software, he same day or the some another day? Okay, okay. In such case, if any patient come after few days or few time later, you should go to registration window, okay, and here you will have option to track the patient with his patient's MRD number, either his mobile number or its name, okay. For example, patient did not bring anything and patient come with the name like he said, my name is Yogesh, I was visited previously to you and I search with the name of patient, okay. So that system will show all the respective name wise patient, that this patient you can see first number, this patient was visited on 12th August 2024, okay, it was under cash. Now if I select the same patient to here, this patient detail will be reflected here in the respective field automatically, okay. Now this, when you want to make this patient under international or corporate, so you can select the type of patient categories at the second time, okay, under which category to be admitted, and here in which doctor it need to be show, for example urology, okay, and I select urologist doctor under OPD, right, and the consultation should be applicable here under the follow-up visit, okay, the respectively. So we have the fetch consultation services, one second, and I use here consultation service and it's coming your 11 and 10 as per the corporate international tariff for the urology OPD fee, right, and just we save and print. The second visit will be marked in the software, okay, and the receipt will be created into the credit payment mode if it is the insurance company's patient, so payment will not be collected, it will be due pending as a payment services, and OPD will be created for second revisit, okay. And after doing so, the patient we can see under the urology prescription, like we can mention his patient's vitals record or any other things, and we can carry on the further treatment as we are doing. So here we have the patient and we can do the patient's vitals record and something like that, and we can mention the other things we like to do, okay, like what patient complaints symptoms like that, and how much duration, what is the body temperature, something like that, and just save. The vitals have been updated. After we send the patient to respective doctor cabin, here doctor can select the patient, and if there was any patient previous prescription history, it will be show here in the patient listing here before we can see, and we can write here the upcoming new treatment to here, like prescription, investigation items, any test to the patient, okay, creatinine test something, and we can advise some dressing services or any things we like to advise for patient, okay, and here we can advise radiology part or something like this way, okay. And we can, if we like to make any medication part also, if we do not want to advise right now medicine, we just want to depend on the after report visiting, so we just save this prescription, lab, radiology facility, and hospital procedure to the patient. The entry will be saved and a printable prescription will come here. Now the patient shall go to the your billing desk to make the payment of respective services. We go here OPD billing system, and just the billing request bell icon will come here in front of respective patient, and we can select the patient, and its prescribed billing will be automatically come with the respective company wide tariff validation, which is corporate, cash or international, like that the amount will fetch here. Okay, and we can select the mode of payment as it is the corporate, patient, international with the insurance company. That's why the default payment is due pending. It means the patient will not make the payment, and we save and print of the respective service for this particular patient. After completing this validation, this entry will process to the laboratory radiology department to prepare its report window, and the patient will reflect into the laboratory department, and here the lab technician will able to collect a sample, prepare its lab report. The rest thing will be going on as we do previously done, like this way. Okay, just need to find out the patient with name, UHID, mobile number at the registration, and perform his the further activity which are the same in the next stage. Okay, here we can mention the reports and something like that, and just we save the test results here. The report will be saved. Okay, once the report are saved, this report can be shown to the respective doctor into the consultation window, and the report will be shown as the payment is due, like that if it is patient is corporate, and this report have been prepared for laboratory department. Okay, after having so, if patient have some X-ray report or radiology report, we can also collect the radiology report for same patient. The patient go to radiology department where he have to perform his radiology services for, and the radiologist user will able to upload X-ray, CT scan, MR report or something other things which he have to do. Okay, like USG something and like that, and the report will be saved here. Okay, with image and text report you can able to prepare its report of the patient radiology. Now the patient go to the respective doctor cabin where doctor will check his reports. So we go to e-prescription menu. Here we can select a patient. Sorry, which patient was there? UHID is, this is UHID. Okay, and we selected the respective patient. Here the respective patient is there. Now the doctor can see the bell icon of the laboratory and radiology report, where they can click of the patient report can be seen here in the e-prescription window with the respective patient. The flow is as seen. Now if doctor like to prescribe any medicine on the same prescription, they can click on the date button. The report prescription will be reopened to update the medicine part of the same prescription. So we can select the product entries. Okay, how much quantity to be prescribed for the patient, so we can prescribe the other product quantity, and the medicine available stock is also showing the system during the prescription writing here, and doctor can make any more product request for the billing side here. Okay, so you can select here the respective quantity here. Okay, not any stock quantity. Let me check any other item is also available. Okay, not available, so we can still advise the medicine if patient like to take from outside something like that, so we can do like this way. Okay, 5 days ODS and 5 quantity after meals. So this is a pharmacy request have been updated for this patient after having look out the report of by doctor. They have requested for medicine now. on the patient. Okay, now this patient has to go to the pharmacy window to collect his pharmacy medication. So we use this UHID and go to medical sales window. Let me go menu, and we go medical sales menu here, and the medicine will be supplied to the cash, credit or due pending, like that. Here we have the requested patient's request will reflect in the pharmacy desk, and here the pharmacy guys will able to supply medicine into credit payment mode of the respective medication. Okay, if any medicine is not in stock, system will give any alert for respective medicine. Okay, so 3 medicines have been in the stock, but last one is not in stock, so the user can able to check the respective medicines, alternate quantity can be given. Hello, yes, I am here. Which one? One second, let me write here. Spell ALF ALTA, this one. Yeah, 80 quantity have been added by you. Yes, it is, you can see the, yes, so it is 80 quantity showing in the system. If I select the medicine, okay, how much quantity to be sell, like the 3 tablet. Okay, so I can select 3 tablet. How much? Okay, one second, 10 tablet. Okay, one second, the price is, let me check what price you define on this product, because price master pharmacy. Yes, let me check it. We go to stock and I search the medicine product here. One, okay, you have added stock quantity 80. Okay, let me check now the price master, what you have defined for the price or not. Okay, if you, so this you see in the item master, you did not edit the price of local, international, corporate. That's why the price is not coming for the medicine. Where? In the, in this window? Yes, it is making auto save, because admin will have the authority. So once you put, like example, I put here for example 70 for local price. Okay, for corporate I put like 120, for international I put 150, and I just use tab button and the entry will be saved for the medicine. Okay, need not to save any because there are lot of medicines, so it time taking save button. I have updated this price. Now if I go to the patient prescription window, okay, and if I will check the medicine price, now it will bring me the respective price of the product, of this product. Okay, correct. So now let me check this ALTA. Okay, ultrasafe. Okay, now you can see, as the patient kind is the international, the international price 150 we decided, so it coming here. Okay, if I sell 5 tablet, so its a price will be multiplied with the 5 respectively of the medicine, and we can sell the patient with the credit payment mode here, and I just save the print receipt of patient. Please enter medicine names here. Okay, so quantity like 5 quantity of medicine. So this total pill value come here and just save and okay. Actually, if hmm, hmm. Yes, master item is automatically added, but the price show me sir, show me the respective item. I will explain the technical logic of the backend. Yes, this is the thing. Yes, uh, please listen me carefully. The system flow, if you bypass some flow, the system will not bring any price. Okay, let me explain how. For example, I select a patient, a new item which is not available in item master. Okay, make it clear. Any item before you are purchasing, you should have to make the price master of all kind of categories. Okay, if you don't make it directly making purchase, for example, let me make an example for you. FPL 001, and I am writing a one product which is not available in item master. Okay, so for example, I put here Zincovit 750. Okay, I am writing here, I am not selecting from item master list. Okay, are you getting me, sir? Okay, like this way, if I item making and I am not selecting from item master, and I have defined here and I put his packing and it's a purchase quantity 500 or like that, and I put here purchase cost of 45, here MRP like 80 rupees. Okay, now this price is valid for cash patient only, be default by default. Okay, now here we have making expiry date, duration. Okay, and I maintain this thing. Yes, yeah, if explain the reason technically. First of all, I have to finish this answer, then I will answer your second question. Okay, so I select one more product like Rebtech DSR. When you are doing here this window, the window drop down, sometime pull all pharmacy tablet master data. If your internet is sometimes slow, the data downloading speed may be vary accordingly. Okay, so please check if you have already created item master, it definitely come here. Okay, so I put two items which was not in the software. I am preparing them here, and I am writing here respective stock purchase quantity with respectively different price like 50 of this one, and I will show how the item is will reflect here. Okay, 2026 like this. I have selected Ginkgo 700 Reptech 700 mg tablets that I have not prepared in master. Okay, now if I submit, the item will be stored in the master product also, rate product master, and stock will be added of the same item. Okay, this was entry have been saved. Now if you go to the stock report menu and you select the product like Zincovid 750, the system will show the stock and price and this price for cash patient like that. If you select any cash patient, the price will be system fetched from the software. Okay, now if I go medical sales window, I will show you. This is your cash patient. Okay, good evening. हाँ जी, good evening. Here I select the patient name. सुनील जी प्लीज़ 2 मिनट रुकेंगे. If I select Zincovid, okay, so you see if I select a patient cash and its a packing was 10, so one product tablet is 8 divided by packing, so price is coming accordingly here. Okay, now if I select one more product Rebatec DSR 750, if I sell 520 for cash patient, its price is taking by software respectively, and I can sell the patient bill of this particular patient. Okay, prescribed medicine should be greater than with the respective advised quantity, and I save this entry. Okay, if I select a international patient, okay, the price will not give the software to me because it was not defined in the system. Okay, so you need to make this price update for the respective product into pharmacy. Go to drug master, and in the drug master medicine, here you can select the product name Zincovid. After have you purchased and you want to update, you can update the price of respective product like 200, 300, 400 or 500 like that, which for the corporate patient or international like that. Same way you can select the Revtech master, and this item have already added in the stock and here also, but price was not there, so you can update pricing of the respective medicine. Okay, and after that you can sell the respective patient to get the pricing. Okay, so this is the logic of system. Okay sir, if I sell now the international patient this medicine, the price will become here. Let me show you. Do you getting, friend? Hello. Yes, are you getting it? Okay, so if I select now the one tablet product quantity with the respective quantity, the price will become here of the international patient also like this way. Okay, now anything else you like to answer the question about this? इधर भी ऑफ कर देना. Okay, so that was the process of the pharmacy setting to be properly carry forward with the respective flow of the system. So this way it will bring you the stock purchasing, sale, pricing, stock evaluation, and it will be reduce the stock after selling and like that. Okay, anything else from any team? Yes. That there are the many things under the patient review, one for the vitals record, the test report, so everything will be not and single cumulatively. You have to go to respective, for example, if you want to see lab report of patient, so you go to patient select and select the lab report. If any reports are there, you can see the report of respective patient. For example, let me see a patient which is maybe the international or something like that, international level report. I search patient here. Okay, internet off हो गया क्या? If I select the patient here, okay, if I want to see this patient leave report, so I click the patient, and I can, once report are ready, we will have the eye symbol of patient, and we can see the report. And if we want to see radiology report, similarly the radiology eye symbol will be reflect in front of the respective patient. Okay, there the report will be show here. Okay, if you like to see vitals entry, you can click on vitals record. The vital record will be reflect here if any mention like that. So the everything will not come in the single screen. The department and the entry wise will come here. Any equipment was running the patient, you can click on equipment to see. If you like to see in single record like that, you should click on the treatment sheet, where the record will be show of respective patient, what treatment we was running over this patient. Okay, oh my question was question was your, I was answering that thing. Oh, okay, the manual inputted notes you like to check. Okay, that will be into the IPD doctor notes window, where you can observe the patient's note. Let me show here. My internet is exhaust, I think. So let me reopen the software for you. So we were discussing about notes where we need to maintain. So here IPD doctor order window here. Okay, for any patient you are writing any notes and something in for clinical side, so you can select the patient, and you can write here nursing notes here in the right side, in the access here right side. Okay, these are the nursing window for morning, evening and night. Same way the evening like that, here morning, evening, night, and you can save the respective entries from here. If you save any for example, let me write something for you morning, evening, and the system, when I save this record here in the respective field, like demo patient admit notes. Okay, I am writing like this with some demo entry, demo and night records of patient. Okay, if I put something like that, and just we save at this one day. If I come the second day, this is his printable record of the patient. If I come second day, if I select the patient, there will be a date window, and if I click on this date, I can get the what I was written on this window. If I want to continue further treatment of the next day, I can write second entry like that something, and I can update with the respective on the same record also. So this way you can continue the treatment writing of the patient services item here. Okay, the clinical record will be, you can mention here in the system side. Okay, so you just put in the morning side, ma'am. If you want to put once in the day, just put in the morning notes, evening note, like no. In India there is the 3 time patient are visited, so we have option to 3 time. If you need only one column, we will revoke that column, no problem. Only one entry will become here. Okay, it's not compulsory that all field to be mentioned. For example, let me say another patient, I want to write only first column value, and I can record morning doctor notes order and the nursing mention follow up like that, and just save first record. System will not barrier to mention the another record also. Okay, first note will be saved, and when you click again the patient, you can able to see again it's printable record. Either you can update the existing record also with the same patient. Continue the treatment entries here. Okay, so I will have to update the two things also you sent me during the conversation. So we will update and will inform you on that system. Okay, so I make request to kindly check the test